Okay, so here we're talking about lacerations, stop the bleed, basic first aid for lacerations and hemorrhage. So there's an organization called Stop the Bleed that promotes this kind of training to basically anybody because blood loss is the #1 killer in trauma. So facts about blood. Blood is essential for life. It carries oxygen around the body and it removes waste. It's pumped by the heart. What makes up the blood? The blood is made up of red cells, white cells, platelets, and plasma. Red cells are what carry oxygen. White cells carry your immune cells that eat up invaders. Platelets are what clot when you have a bleed. And plasma is what carries your nutrients around your body, like your electrolytes, sodium, water, stuff like that. So trauma, blood loss is the #1 cause of preventable death in trauma. So at a mass shooting or someone on the playground breaks their leg in half and severs their femoral artery, that kind of trauma. Blood loss will kill you. So loss of blood causes shock, and shock causes death. You can't reverse shock once you get really deep into it. So the ABCs of trauma: A, alert; B, bleeding; and C, compress. So we'll go into that a little bit further. So A, alert. That is call 911 if you experience trauma to yourself or you see a victim. So you see someone get shot, you get shot, anything like that. You need to get first responders on the way. So bleeding. Bleeding is looking for the source. So you've got to take clothes off. If you've got scissors in a first aid kit, you've got to cut the clothes off. You need to expose the bleeding. So remove or open clothing to expose it. Because once you can expose it, now you can see what's causing it. So the next step that you're going to worry about is determining if it's a life-threatening bleed. What is the life-threatening bleed? It is blood that is pooling on the ground, blood that won't stop coming out of the wound, no matter how much pressure you put on it. Blood that's spurting, that's an arterial bleed, and it will pulse with each heartbeat. Loss of all or part of an arm or leg. Clothing that is completely soaked with blood. Bandages that are soaked with blood. And people that are losing responsiveness or unconscious due to blood loss. Those are all considered life-threatening bleeds that you need to intervene and stop. So, C, compress. If you have a first aid kit, apply direct pressure. If you do not have a first aid kit, apply direct pressure and cover the wound with a clean cloth. You push with both of your hands. So if you have a shirt, push, cover. If you don't have a shirt, you have a clean towel, push as hard as you can. You want to compress it as hard as you can with both of your hands. If you do have a first aid kit that has a tourniquet, this is a tourniquet. I'll demonstrate how to use it in just a minute. You will apply the tourniquet 2 to 3 inches above the joint closest to the injury. On your leg, you always want to go above the knee because your artery runs between the tibia and fibia, and so you can't really compress that if it's between 2 bones. You always want to put it on the femoral artery. Up here, you want to go above the elbow. You don't want to put it on a joint. Put the tourniquet on. You do it. You'll mark the time. You'll see the bleeding stop. If you've got life-threatening bleeding and you don't have a tourniquet, use wound packing or hemostatic agents to pack the wound, and we'll demonstrate that in just a minute as well. So let's hit the lights. We'll do tourniquet and packing. So real quick with packing, you want to expose the wound. It's going to hurt the patient. They have hemostatic gauze that can actually go in wounds. I don't have a wound thing to actually show you. But basically, if you can imagine your leg like this, way. If you imagine your leg, you're cut right here, you see? You want to expose it, and this would actually unravel, and you will pack it into the hole. It's going to hurt. Unravel it. You'll pull it apart, pack it little bits into the hole. Then when you get done, you'll wrap it and compress it. So tourniquet use. Anybody want to come up here and feel my pulse? Because I'm going to show you how to do this and you won't feel my pulse anymore. Anybody? Real quick? No? Okay. So anyway, to put a tourniquet on, you'll slide it over the injury. You have to pull it insanely tight. and you Velcro it. Then you take this little twisty thing and you twist it until the bleeding stops. And it hurts really bad. Then you see this little Velcro right here. You'll spin this, put it underneath. Go across, write the time, check for a pulse. It's really creepy. I don't have one in my